Hi class, welcome back. We are going to continue with the lesson on dilution and we'll be looking at reconstituted mixtures and intravenous admixtures. So the outline for this lecture is that we want to see what would the definition be for a diluent, a solute, suspension, or a solution. And once we have gotten that out of the way, identifying what are reconstituted powders and admixtures, then we will go straight into the concept of calculating the solvent that will be added to these powders to prepare a desired concentration. And we'll be using both the concepts of ratio and proportion and the CSVS method. Okay, reconstituted powders. Some of us are mummies and daddies, and we would have carried our little ones to doctor, and the doctor would have prescribed an antibiotic. When we carry that prescription to the pharmacies, they often have to mix the antibiotic. In many cases, or in some cases, not many, but in some cases, the pharmacist may even instruct the mommy or the daddy on how to reconstitute these powders. So we need to determine what these are so that we have a better appreciation when we are doing our calculations. Why do we have reconstituted powders? Main reason is that these drugs, typically antibiotics, but not limited to antibiotics. You have other drug substances that also have stability issues that are formulated as reconstituted powders. These drugs tend to lose their strength or potency very quickly when they're in an aqueous medium. And therefore, what the manufacturers have done is that they have formulated these drugs in either a suspension or a solution, and then they remove the solvent, leaving behind the powders that is much more stable than if the drug was in a liquid form. It is when the drug is required, like on a medication order or prescription, that the drug is reconstituted, meaning you're adding a diluent to it to bring it to a particular concentration. And this facilitates the patient taking the medication without it going bad or the potency being lost, and it remains stable up to 14 days under refrigeration. So let's define a couple terms. Reconstituted powders may either be a powder that when reconstituted produces a suspension or it produces a solution. And this may be used either for oral use or for parenteral use. And parenteral, as we all know, is when you're giving an injection, right? So suspension for oral or parenteral use. Suspensions, as we know, have or contain finely divided drug particles that are dispersed in a liquid vehicle, which is quite different from a solution, which contains solutes that are dissolved in a liquid medium, in a solvent, to form a mixture. That means you won't see any particles swimming in there. And the diluent is what you use to add to these to prepare these two dosage forms. Reconstituted powders, as I said before, are powders that are prepared from original liquid form by removing the solvent, either by freeze drying method or other such methods, and the liquid is added to restore the original liquid formulation at the point at which the drug is needed, usually at the point of dispensing. So these are examples of reconstituted powders. Most persons would be familiar with augmentin. Augmentin is an oral antibiotic, and it comes as a powder. And that powder is then reconstituted when the pharmacist gets a prescription, producing an oral suspension of a particular concentration. And we'll talk more about those concentrations further down in the lecture. We also have suspension for parenteral use. This is daptomycin, which is another antibiotic, which is reconstituted with a diluent and produces a suspension of a particular concentration. And of course, I tried finding solutions that are also reconstituted, but unfortunately, I was not able to find that. So I'm still on the hunt for that, and I will share that information with you. So these are the examples of diluents that are used commonly for reconstitution of powders. Sterile water for injection, of course, will be the diluent of choice to use to reconstitute your parenteral reconstituted powders. Now, you're not going to go to the tap water to pour water into your vials to reconstitute your injectable solutions or suspensions. You have to use something that's sterile, and sterile water is the diluent of choice. The diluent for oral preparations are usually purified water, and of course, or normal bottled water is considered purified water, which is normally used in the pharmacies to reconstitute oral reconstituted powders. So this is a typical label of a reconstituted preparation. This is amoxil, another popular antibiotic. Amoxil is a brand name. It is the trade name from GlaxoSmithKline Beecham. And the active ingredient is amoxicillin. And if you look at the label, you see that it is amoxicillin for oral suspension. So when we look at this label, we need to identify certain things, very important things on the label. Okay, we identify first the concentration. And the concentration says 125 milligram per 5 mil. It means that every 5 mils of amoxicillin suspension is going to contain 125 milligrams of amoxicillin. Now, we do not have, remember, the amoxicillin comes as a powder, reconstituted powder, that the pharmacist will store in her antibiotic cupboard. This is not reconstituted until it is needed at the point of dispensing. But it is very important for us to understand that once reconstituted, we're going to get a concentration of 125 milligrams per 5 mils. We also need to understand or identify, the final volume after adding the diluent. And that final volume is found here. And it says 100 mil when reconstituted. So how do we obtain this 100 mil? Do we throw 100 mils of water there? Most likely not, because this is a suspension. And as we said before, suspension has finely divided particles dispersed. It's not dissolved, but dispersed in the mixture. It means then that those tiny particles are going to occupy a certain amount of space. So adding 100 mils to your reconstituted powder is not going to end up with a final volume of 100 mils. It's going to be more because the powder occupies some amount of space. So how do we determine how much of the diluent to add? We have to identify the volume that the manufacturer is telling us to add to get the concentration stated and the volume, the resulting volume upon reconstitution. And that's right here. If we read this information here from the manufacturer, it's telling us to add 1/3 amount of the water for reconstitution, which is a total of 78 mils. So you will measure 78 mils in your graduated syringe and add to your bottle, shake it up, and you'll end up with a final volume of 100 mil with a concentration of 125 milligrams per 5 mil. So this is what a typical reconstituted powder product will look like, whether it be something for oral use or for parenteral use. The concept is still the same. You still need to identify how much water to add or how much diluent to add. You need to determine, once you add that diluent, what will be the final volume and the final concentration. You need to know where to go to look for them. Augmentin, this is an antibiotic, as I've said before, and I found this to be very useful. It tells the compounder how to formulate or to reconstitute the powder. First, you shake the powders to loosen them, of course, and then you add the required amount of water. If you work in the pharmacy, you will recognize that some of our oral suspensions for reconstitution, they may tell you, the manufacturer may tell you the amount of water in terms of milliliters to add to get the required volume and concentration, while some will point to a line. In this case, the augmenting for this particular augmenting product, a final a total volume of the diluent is not stated by the manufacturer. Rather, the manufacturer indicates that you are to add enough water such that the suspension goes to this fill line. And you have quite a few drugs on the market that has that kind of instruction. It's pretty much for those dispensing scenarios where the pharmacist will instruct the patient what to do, especially if the drug is notoriously unstable. You want to use it when you really need it. So for example, a doctor may say, okay, I want you to give this child the antibiotic in 2 days. You don't want to make the drug now, especially if you decide that you're going to go to the pharmacy earlier than the 2 days. The pharmacist can tell the caregiver how, or instruct the caregiver how to prepare the reconstituted suspension. Again, I don't think a typical household will have measuring cylinders lying around in their cupboards. So this is quite useful for a person who is not so knowledgeable in terms of glassware or don't have the glassware, but will be pointed or directed to add such that the final liquid comes to the fill line here. So of course, you're not going to add all the water, a lot of water up to that fill line before you shake, because as I said before, the powder occupies a certain amount of space. So you would add just a little water, shake, make a liquid, and make sure that the liquid forms, and then you add up to volume, which is what you would instruct your patients to do. This is admixtures now of parenteral dosage forms. So you reconstitute your oral mixtures, suspension or solution, depending on what type of dosage form the manufacturer would have been making. And for parenteral use, we call that admixtures because you're adding to make a mixture, right? So here, this is oxacillin sodium for injection, and the manufacturer would have stated that you need to add 2.7 mils of sterile water for injection. So you take out the 2.7 mils of sterile water for injection with a hypodermic needle, and then you add this to your oxacillin sodium vial and shake it up, and then you would have your final mixture. Okay. This is just a demonstration of how it is done on the ward. Now, you probably will not be making these reconstitution yourself. You'll probably be sending the vials to the ward if you're working in a hospital setting or any institutionalized medical facility. And what you need to understand is that the vials come as this, and they require a certain amount of diluent to be added based on the manufacturer's recommendations, and the nurse would follow these instructions and prepare the dosage form. Okay, so we went through all of the preliminaries, so we're going to now review what we have learned. When we look at a label like this, the first thing we're going to look for is one, the Resume.